We're here this morning with Deb Lee, who is the Director of the Council on Aging for the City of New Bedford. Deb, we're in downtown New Bedford here. This is a big thing that's going on.
It's very busy. There are about 80 vendors here, and we get upwards of 400 seniors that will come in today just looking for what's going on and how they can find resources and help to provide them with everything from nuts to bolts.
You say 400 seniors. They're from the area or just from New Bedford?
They're from the area, so we have people here probably from Dartmouth, Westport, Rochester, Lakeville, all around New Bedford.
The vendors fall into what categories?
Services that are available to seniors, so there's home health aid, home health care, there's diabetic shoes, there's oral hygienist. You can come down and get a free oral screening for your teeth. There's lots of different, AARP is here, Mass Senior Action is here, lots of different vendors just offering people resources, Brandon Woods, community nurses, lots and lots of vendors.
Well, that's great. How often does this happen?
They do this once a year, and the Coastline actually usually spearheads it, and they partner with one of the Council on Agings that fall under their roof, which includes Dartmouth, New Bedford, Acushnet, Mattapoisett, Marion, Rochester, New Bedford. And what they'll do is they'll partner with the COA to put on the particular health fair. And so this year it's our turn. And so they've come to the Andrea McCoy Gymnasium to do this. And it's a great event.
And I want to just emphasize, there's no charge for the attendees.
There's no charge for the attendees, no.
There was something else I noticed, a different sign that I've never seen before about New Bedford is now an age-friendly city. Could you tell us what that's all about?
New Bedford is working towards age-friendly designation, and what happens with that is we actually put in an application to AARP, who spearheads this. It's part of the World Health Organization. The cities, too, when they make improvements or when they make changes and things in the city, that they do so with age focus in mind. So when you put in a walking path, you make sure that there's enough benches for people to sit down. You make sure it's well lit so that it's safe. Any improvements or any changes you make to the city, you do so with age focus in mind. So we get everybody at the table from all the different departments, a lot of different agencies sit on the committee as well to be able to brainstorm what's important. And we're currently actually doing a survey that we're trying to get out to as many New Bedford residents as possible, telling us about your neighborhood. Do you feel safe? What improvements can be made? And so once we survey everyone, we'll get that back and we'll have more of an idea on exactly what we need to improve the city.
So this special naming is something that we're still waiting on.
We actually have already received word that we have the go-ahead. The mayor actually received a certificate at Coastline's annual luncheon. And so we're working on it. It's a 2-year plan in the planning process to be able to get everyone at the table and figure out exactly what the needs are based on the survey and then start the work. But we are working toward the designation as well as a few cities also in Massachusetts that are working toward that.
Well, that's great. I know that you in particular are busy as the hostess for this event, so I want to thank you for spending a few minutes with us.
Thank you.
And
it's
go get
always great
them.
to see you. Thank you. Thank you.
We're here this morning with Gerald Flaherty. Gerald is with the AARP. Welcome to New Bedford, Jerry.
Well, thank you, and thank you for the work you're doing here to get some publicity for the agencies that AARP is involved with in New Bedford.
Now, why is AARP here?
Well, it's to publicize the various programs that they have, from Fraud Watch to the Age Friendly Initiative, which is a program in New Bedford. It's the program I'm most involved in as a member of the Executive Council at AARP here in Massachusetts. Mayor Mitchell has signed on. It's a World Health Organization program. AARP is the principal sponsor in the United States, and New Bedford is one of a handful of cities and towns in Massachusetts that have signed up to the initiative. What it does is survey the people of New Bedford, the elder citizens, people 50 and over in New Bedford, about their needs and what they really need to make their lives more livable in their communities. So it's a collaborative with the Council on Aging in New Bedford. Deborah Lee is co-chair with Paula Chiner of Coastline Elder Services, the CEO. They co-chair an advisory committee that's putting together a survey right now that's available today, and we're passing that out at our AARP table, that would survey the needs of the people of New Bedford in terms of transportation, housing, safety, so many other issues that the World Health Organization has identified as critical to healthy and safe aging. New Bedford, we're happy to say that my role here is for AARP, living in the community, is to help facilitate the work of that advisory committee and of Mayor Mitchell's office.
We're here again visiting with the special person, Mr. George Smith, friend of mine, friend of the city's, but most importantly, a friend of the seniors.
Absolutely.
George, tell me why you're here.
Well, we're here representing Mass Senior Action Council, which represents about 1,200 people in the state, probably about 154 right now current active members in Fall River and City of New Bedford. And we're here to let the people know some of the issues that are really affecting the seniors. If they haven't heard of, we're here today to explain some of them. One is the Health Safety Net, which is a program that all hospitals contribute to, and it's for the people who don't have enough money to pay for their health care or have very little health care. The governor has proposed to cut that starting June 1st. So we just want people to be aware of that, to call the governor and tell them not to make that cut, because the cut's also going to make an increase in their deductible of $500. The other things we were working on, we have a plan or a solution to the cut, and we've been talking about it for a year and a half. It's been filed by the legislators, and it is the medical gap program, which would help a lot of people get on some assistance for Medicare. So we have that here. We also have a paper we send out quarterly. If you'd like to be a member of Mass Senior Action, it's $10 a year. We love to have you. We meet once a month, the fourth Thursday of the month at St. George's Church in the rear of St. George's Church. And the other thing we're looking at is dental is a major problem with seniors. If you talk to any seniors, or many seniors, they do not have any medical coverage, not go to the dentist till it's time to pull their teeth out. And many doctors can tell you a lot of the health problems, especially in an area like New Bedford, is because of dental. So we are looking at a program that's in Minnesota, I believe it is Minnesota right now, that a person who does the cleaning of the teeth can do 14 or 15 steps more and be something like you have nurse practitioners in a doctor setting. Dentists do not have, they just have the person that cleans your teeth. So a lab technician, give that person more responsibility, and we're hoping that would get more people to go to a dentist. Okay. Could hopefully lower the price of dental.
Now, George, as a member of the public, I happen to be a senior, and I want to join Mass Senior Action. How do I go about doing that?
Well, you today can get a paper. We have in the back of the paper, inside the paper, a application. All it is your name and your address right there, yep, and become a member. Okay. If you'd like to call me or my coordinator, Cookie, I'll gladly sign you up. Call me at 508-951-4714. I'd gladly send you an application, become a member of Mass Senior Action.
Do you have a website?
We do have a website, which is not...
we'll put the name up on the screen. So.
Okay, I'll get that for you. Okay? Mass Senior Action Council. Okay. It's stationed right now in Dorchester. We're going to be moving to Quincy.
So what you'd like to do is double the membership at least and get more people involved with this.
It's basically, that's the whole thing. And a lot of people say, well, I don't want to get involved. Really getting involved is telephone. Yeah. Right? You become a member, you get to know the issues that are affecting seniors. We get you a paper every 3 months. We love to have you come to rallies and demonstrations. We just had a rally at the governor's office this past Wednesday. But a lot of people say, well, I'll drive it to Boston. Well, we don't only have rallies in Boston, we have them locally. We've got involved with the SERTA issues, the buses, demand response for the seniors. We've been involved with housing. We've been involved with a lot of issues that are local also. And a lot of times we need you to call your legislator. It means more to call than to sit back in your chair and complain.
Yeah.
So a simple call, we'll give you the phone numbers of the people you have to call. We'd let you and make you aware of what the issue is and how it affects you and make that call.
It's nothing but plus. Everything I'm listening to is the right way to go.
Thank you. That's why you're my friend.
And we're going to let you get back to talking to some of these folks that are visiting today.
Thank you.
George, thank you very much.
Appreciate it very much. Thank you.
Mr. Quinn,
Good morning.
welcome to New Bedford. What brings you here?
Well, I'm here to offer a few remarks that focus on one of my priorities, which is elder abuse and prevention. I have been speaking out about that issue and made it a priority because it is rampant in this country and these communities that the elderly are being taken advantage of by scam artists and also, unfortunately, family members. So I'm trying to carry a message of prosecution of these cases, putting resources into investigating and prosecuting them if the evidence warrants it, and also prevention, because certainly if we can prevent these things from happening, everybody's better off.
Is this problem shrinking or growing?
It's growing, not that it just started happening, but it's all around the country. People, the elderly are a vulnerable group. Some are isolated and alone, and people in a position of trust come in. They try to take advantage of them, and I think it's only getting worse. I read an article recently, about a month ago, in the Florida paper, how there was a scam being perpetrated. It was either on the front page of the Metro section. So it's everywhere and getting worse. People are living longer, which is great, but there's just more opportunity and more vulnerability for individuals who are not of the appropriate moral character to take advantage of loved ones and others.
How do you punish them when you catch them?
Well, it depends on the circumstances. I think there has to be an accountability. If we can prove it, we bring charges and the case goes through the court, but in many cases, the victim is a family member, could be a blood relative, mother, father, so they're uncomfortable with the prosecution, which is understandable. So it's difficult, but the bottom line is this. Elderly have given much to this country, and there has to be an accountability in the latter stages of their life. I just not going to stand by and watch people have their lives turned upside down. If we have the evidence to prove the case.
I know that it takes on a personal note for you, as it does for me, because unfortunately my mother was a victim of a scam artist when she was alive, and it was a very trying thing to go through.
Well, it is, and I think put aside the money, which you can't, but the psychological impact that someone has been duped, and in many cases for large amounts of money. My father, was attempted to be scammed through this IRS fraudulent scam, and I ended up calling him back and pretending I was the IRS. Unfortunately, he took my advice, and they got my identification, my district attorney credit card, and tried to place online bets. So it's everywhere, not just the elderly. There's a lot of thieves out there looking to take advantage of people, and when it comes to money, people often the worst comes out with people when they see money and a potential opportunity to take it.
Well, I know that you're a busy guy and there's a lot of people here that you've got to visit, but we look forward to your remarks from the podium, and I want to thank you for taking a few minutes out to be with us.
Thank you for your time.
Thank you.
Appreciate it. One of the priorities I have carved out is focusing on elder abuse, in particular fraud and obviously neglect. It's quite clear that there are a lot of individuals out there that are trying to take advantage of the elderly. Our older population has given much to our country, and I simply am not going to stand by in cases brought to my attention and see them abused, sadly, by family members and scam artists. So I've created a unit to focus on the prosecutions, but even more importantly, a prevention aspect where I'm going out to talk about the different ways that people can avoid scams and not get sucked into giving money that they're never going to get back. So it's great to see everybody here availing themselves of the different opportunities. Again, our elderly are a precious commodity, and I'm here to support you and do what it takes to either hold people accountable and hopefully prevent some of the fraud from taking place. Thank you very much.
Here at the Senior Health Fair, what are we calling it? What are we calling this?
Senior Health Fair.
Okay. We're talking with the AARP representative, the volunteer. Your name, sir?
Dennis Hohengasser.
Okay. Dennis, are you local to New Bedford, or are you
I'm from Taunton.
from Taunton? What is AARP doing here today?
AARP is providing a lot of information for seniors on keeping themselves healthy, keeping themselves safe. Specifically, I volunteer with AARP on the Fraud Watch Network. And it's a program of a 1-hour presentation that we've been doing statewide to elders, teaching them how to recognize fraud and how to protect themselves from becoming a victim of fraud.
Hard job?
It never surprises me to hear the stories that I hear at every session about how people were taken by one scam artist or another.
This is a problem. It's not unique to Massachusetts, I know that. But is it a problem that seems to be growing or shrinking?
I think with the expansion of the internet, it's a virtual buffet for scam artists. They don't have to leave home. They can do everything right from the internet. And it can be a very scary place, especially if a senior is not really comfortable using the PC or receives emails. They're not sure where they're from, but they want to read them just the same. Oftentimes, simply clicking on a link within the email can download some malware onto your PC so people can start to capture your credit card numbers, passwords, and those types of things.
And this is the message that you're trying to get across. I'm
Yes.
sure the district attorney is another one of them, but as a resource, AARP, your reach is much greater because of your national scope.
Right. It's being done across the country now. It was piloted in about 22 locations, and as of, I think, a couple of years ago, it's been rolled out nationwide.
Does the fraud watch that you're involved with fall in any way under this new category of age-friendly New Bedford?
I would imagine, yeah, it does, because fraud can happen to anybody, and it really affects seniors probably a lot more. Elderly people are usually more trusting. When a phone call comes in, they're less likely to just hang up on the person because we weren't brought up that way. And the other thing is, they may not have a great command of using a PC, and sometimes simply clicking in the wrong place at the wrong time can do some damage.
I think my commendations for what you're doing and for what AARP is all about, because I think that you have a grasp of the needs of the seniors, and that's very important. Thank you for your time. We've got to push on. Enjoy the show.
Hi there, welcome. Have a postcard, Island Terrace. You can put it on your refrigerator.
We're here this morning at the Senior Health Fair, and we're talking with one of the exhibitors, one of the vendors here. And your name is?
Holly Petruzzo. I'm a public health registered dental hygienist, and my business is the Visiting Dental Hygienist, LLC, and I go into nursing homes, private homes, assisted living, and the Council on Aging. I work with Coastline Elderly with a program that we can supply free preventive dental work to people who do not have insurance or over 60 and live within the towns that
Is this important for seniors for dental care?
Absolutely. It's one of the biggest reasons in their state because you have a lower saliva flow, you have between medications and whatnot, which causes a dry mouth. You have health issues of diabetes and whatnot, and if the mouth is not clean, it's going to throw these things in balance, and it has heart issues and everything involved. They finally realized that the head is actually connected to the rest of the body, and it has a big effect on what. This is a barometer of what's going on in the rest of the body. If the mouth isn't healthy, the rest of the body isn't going to be.
Now, I'm going to guess that you don't go around the state doing fairs like this. You actually get into the centers and into the...
Yes, I don't. I do a couple fairs a year because Ann McGrillis of Coastline Elderly invites me. But other than that, I try to I'm too busy out in the field seeing people in their homes and whatnot.
Has it been successful?
I think so. You know, it's I get a lot of positive feedback from people I see that they say it's a godsend. They wouldn't be able to get the care if I wasn't out there. So, in that way.
I'm going to guess that there might be a problem with seniors on limited income getting the funding to pay for proper dental care. Am I right there?
Yes, that's the biggest problem they have. A lot of people out there that need extractions, they need dentures, they need partials, and they can't afford it. And that is something I keep trying to find a way to see if we can find funding for these people.
Thank you very much. We know that you've got a lot of people to talk to at the fair, and we're just going to move on and talk to someone else. Thank you.
Thank you very much.
Thank you.